Hi, my name's Charles Alessi. I'm Chief Clinical Officer for Edito Health. And today we have a wonderful opportunity to extend our For Health's Sake interviews by having a conversation with Juha Jolkkonen, who is the Executive Director for Social Services, Healthcare and Rescue Services for the city of Helsinki. And what a role that is, combining all aspects of care for an individual. So Juha, help me. Could you just encompass what your role is here? Because you're in an unusual situation.
Well, as you said, well, it's nice to be here. Thank you for inviting me. As you said, I'm responsible for all the social care, social services, healthcare, and also rescue services from the beginning of this year for the residents in the city of Helsinki. We have 650,000 inhabitants, so we are about 12% of the whole population of Finland. And as you mentioned, we have combined social and healthcare for about 10 years ago, and now we combined also rescue services. This is part of the national reform in other parts of Finland. Started a new healthcare, social care and rescue regions that are between the national level and the municipal level, starting in the beginning of this year. But in Helsinki is an exemption. We are still a city responsible for these same services, but actually our financing comes now from the government, not from the municipality. So this is a major reform also for us. Our budget, yearly budget, is about 2.7 billion euros. We have about 16,000 employees of our own, and of course we buy a lot of services for more than 450 million euros. We use to buy different kinds of social and healthcare services. So it's a huge amount of services, very different kinds of services, from preventive care and open access care to all the heaviest 24/7 care and services.
Now, I mean, that's some role, of course, but what I find really quite interesting is the fact that we're in a world where the importance of social care and social care delivery is becoming more important, and perhaps nowhere more than in places like Finland, because of course in Finland you have one of the most accelerated aging populations, if not, sorry, the most in Europe. So and with increased aging, of course, the dependence on social care and healthcare becomes ever more obvious. Now, a lot of countries in Europe, actually most countries in Europe, are really struggling in terms of healthcare delivery. And of course, we're all in this together. But in some respects, you have a significant advantage, because the biggest issue people always bring up is social care. Social care, it's not connected. There's a problem. We haven't managed that process. Now, what have you learned over the last 10 years where health and social care have been united in one? What is the biggest message you wish to give to people who are listening to this around the benefits of that and the problems associated with it?
Well, as you already might know, we have calculated in Finland and also globally that about 10 to 20% of patients or clients, they spend about 80% of social and healthcare money. So the majority of the money goes to a rather small population.
Yeah.
Of course, we all understand there are many people that really need the 24/7 care. They need the services, or they are disabled, or so you can't really influence on their situation. But still, if we just can influence on a small proportion of them, we can actually liberate a lot of money to use in other services or in preventive care and so on. And of the overall money spent on social and healthcare, about 60% goes actually to social care. So this is rather important. And of course, whatever we can do to prevent the need of heavier social care services, or if we can have the service chains working together with, for instance, emergency services and hospitals and nursing homes, it's critical. It's critical, and we all know these emergency service problems in the UK, also in Finland, in many other countries at the moment. After COVID, it has been expanding. The problem is bigger than ever, and of course we can combine also different kinds of professionals and competencies when we have social and healthcare together. It's not always the doctor that we need to do something. We also can, of course, find other, you mean mental care professionals or physiotherapists or social workers and many other professionals in the same team when we have these services combined. Another advantage, but it's actually also I would say, a challenge, is the data. Is the data that we should have available for the whole social and healthcare team. So we should have all the personal data from patient or client that all the professionals could use. We are trying to do that, and we have achieved on getting some data open to all the participants, but still the EU data protection and the legislation is quite complex. It's actually quite difficult in having these integrated services. So that's, I think, one major challenge that we should tackle in the future. We have actually a common EMR or a common data system. We have implemented EPIC in our system, but we have expanded it to cover also all the social care. So we have specialized healthcare, primary healthcare, and social care in the same system. But we have been building some walls inside the system because of the legislation.
Of GDPR.
Yes. Yes.
And I think one understands it. GDPR isn't made for combining that level of data.
Exactly.
The thinking behind it is different, but I can see the challenge. But of course, this is something which, to a degree, we need to overcome because, as you say, because Finland has been exemplary again in another area, because in 2022, it spent the whole year ingesting all that social care data. Yes. All over the country, which is something that I think no other country has done. So this is really quite exceptional. But of course, to actually gain the insights from that data, one needs to be able to interrogate it. And clearly the ontology, the structure, isn't the same everywhere in Finland. So there is a potential problem, but there's potential more work to do, in other words. I was also struck by your comment around 60% of cost goes to social care, 40% of cost goes to healthcare. Now, in the majority of Europe, I think the converse is true. The healthcare tends to take the majority of budget, and healthcare tends to look to social care as the, excuse me, I'm not being disrespectful, poor relative. We know this is not the case, of course, because there's nothing which influences certainly the care of older people more than social care. It's obvious. But did you find an awful lot of challenge in actually getting those budgetary lines? Because I can imagine in some countries, if that was known, that 60% of income went to social care, not health, there'd be the media would go crazy saying health of our population is being mismanaged. I don't think it is, but how did you manage it in Finland?
Yeah, well, it has not been easy, and of course we have been having quite a lot of discussion between healthcare and social care and what's right and what's wrong. And of course, it's also a matter of definition. What do we count to healthcare expenditure and to social care expenditure? We also have had for years many doctors and many nurses also in the social care sector. So it's also a matter of definition. But still, if we have all the money, all the budgets together, for instance, in my area, in my division, we allocate the money together. So it's not healthcare money and social care money.
Yeah.
Completely, the money is the same, and we allocate it, we reallocate it during the year if necessary. It's quite flexible actually to do this inside a social and healthcare system. Of course, we always lack money, but still it's we can reallocate it if necessary. For instance, we have seen some rise in childcare costs or in some other branch, but we can cover it from some other area. So I think it's wiser to have the money and the leadership and the decision making in the same context and in the same unity than separately. But of course, roles are different. For instance, I just met a GP from Netherlands, and he said that he is actually doing quite a lot, something that we have our social workers or some mental care nurses doing. So their GP had actually quite a big role in helping people and also in a way spending the money or guiding the money inside the system.
Well, I mean, that's really interesting, because I think we can find examples of physicians acting in different roles in a similar way to we find others acting in physicians' roles. That's absolutely correct. But you mentioned an area which I think is a point of pain for all of us, including in Helsinki, and that's workforce.
Yes.
We have certainly a significant issue regarding availability of workforce, scarcity of workforce, aging workforce, burnout in workforce. Now, I'm sure you are not immune to all of this. How are you managing it?
Well, we are managing, but of course it's a major problem, and it has really gone worse during the COVID for many reasons. But still, I see, or we see, no other alternative but to increase digital services, increase automation, increase also self-care, and increase the ways that people can take care of their care or can take care of themselves more, and we kind of support or coach them to do that, because we have no area at all that we should say that we don't lack any personnel. So it's doctors, nurses, social workers, you name it, also rescue care services with Carsten. And it's a major problem, and we can't really educate all the youngsters to social and healthcare. So we need to do major structural reforms. The way we have been organizing social and healthcare and also rescue services, it's not working anymore. We need to focus on those most fragile people and those situations where we need face-to-face contact or human care. And we need to liberate resources from things that people can really do themselves. And of course, working age people, young people, they are really keen on using digital services if we just provide them, and if they are usable, if the accessibility is good, and if they really meet their needs. So I think there's also a demand of these kind of services if we just are fast enough and agile enough to have them. And
well, I mean, you have an advantage, Juha, because you started pretty early with Kanta. And Kanta, for our listeners, is a thing of wonder, in my opinion, because it's one of the earliest interventions on a state level to allow citizens to access their health data. And surprisingly for me, in the beginning, I could barely believe this. It's really well used, because a lot of us try to do this globally. And there are a lot of systems which are out there, but people tend not to access them. But in many respects, the legislation, the processes drove people to access Kanta. So I think you're in a good place to do that. My final question, because I don't want to take up even more of your time, and it's really around prevention and population health. You're in a very good place to manage both. Yes, you talked about health security, in other words, rescue services. But but there is the potential to actually manage health promotion for the population of Helsinki in a way which a lot of countries would only dream of doing in places, because you have everything unified. What major interventions are you thinking of actually implementing?
Well, actually, the traditional ones are, of course, important. Fighting against obesity and smoking and the use of alcohol and other substance abuse problems. But actually, some things that are increasing, of course, is mobility and ways to help people to move, to not really to exercise, but to move in their everyday life using their feet or bicycles and these guys. It's a major thing to promote this kind of activities. And of course, the other ones are all the cultural activities and the accessibility for those. I think these are, I would say, the newest and the most important that have came on the side of these so-called conventional healthcare preventive methods. And in this way, we have a special place here in Helsinki because we have a social and healthcare responsibility with us, the rescue services, but also the other city actors are very committed to doing this. And we also have just a small amount, but still some small amount of financing also to this kind of prevention. And it's really beneficial, and people have been understanding it. Actually, the social and healthcare reform we're having in Finland now, it actually has been helping us to get the other actors involved in this. It used to be only the social care or the healthcare that took care of this, but now others have also realized this is something that is one of our major things and responsibilities.
So really what we're talking about is health in all governments, in all departments, in all, absolutely.
Yes.
I think we'll continue this conversation really over the next few months, of course, culminating in the Radical Health Festival in June, where we'll be talking a lot more about this. But thank you very, very much for spending a little bit of time with us. And I hope the rest of your day goes well. Thank you.
Thank you so much, Charles, and I'll see you all in June in Helsinki.
Thank you.
Thank you. Bye-bye.